Hello everyone, my name is Dr. Rahul Mahajan and I am one of the consultants who treats and takes care of patients in autoimmune bullous disease clinic. This month, in November 2023, our clinic completed 10 years from its time of inception, and during this last decade, we had the opportunity to treat approximately 2,000 patients diagnosed with autoimmune bullous diseases. And our experience has taught us that many of these patients have lots of questions in context of their illnesses. And through this video, we have tried to answer some of these questions, and we hope that you find this video very useful. But even after this video, if you have any other queries, do not hesitate to consult with us in the clinic. The clinic is held once a week, every Wednesday. The first thing that the patient often asks is, what are these diseases? Why did I get these diseases? And how do I get rid of this disease of mine? So these autoimmune blistering diseases like Pemphigus and Pemphigoid, these are chronic illnesses that have a waxing and waning course. That means that at some point of time the disease will be very severe, requiring lots of treatment and medications, and at other points with treatment it goes down into complete remission and you can be free of disease also. And these diseases occur due to antibodies against self. That means our body attacks against the proteins in our skin. Though antibodies in general that we understand, they are very helpful in fighting the foreign organisms and fighting the infections, but sometimes they do get misdirected and they start attacking our own proteins only. Our skin, which is the largest organ of the body, is made up of several proteins that help in the sticking of the cells in the superficial layers of the skin, that is the epidermis, together and along with joining it to the deeper layers of the skin, that is the dermis. Due to the antibodies against these skin proteins, this bridging or the joining between the cells and the layers of the skin is damaged, leading to blisters, and which in turn these blisters they rupture to form erosions, and often these can get infected and leading to complications. As I mentioned previously, these diseases are chronic. They often require long-term treatment, which makes the patient quite frustrated and many times depressed also. But there is no need to get depressed, because with adequate treatment the patients do achieve complete remission or freedom from disease also. But they have to be on treatment for longer periods of time. And one of the major concerns of many of the patients is what are the long-term effects of various medicines that we use for the treatment of these diseases, whether it is prednisolone or any other oral medicines which suppress the immunity. Per se, it's very difficult to predict the natural course of this disease, but most of the disease they do very well with treatment, and they often go into a phase of complete freedom from disease, what we call as clinical remission of the disease, and then we try our best to stop the treatment for as long as possible. But some patients may have this disease-free period for few months and some for several years also. We understand long-term treatment with some of the medications like prednisolone can cause some harm, but we try to monitor for these side effects of the medicines, and we try to reduce the dose of all these medicines and stop them as early as possible, depending on your response to treatment. Herein lies the importance of adherence to therapy also and regular follow-up also. But treatment or medication with drugs is not the only aspect of management of a patient. What is also important is maintenance of overall diet and exercise. So since this is an educational video, I often try to memorize myself also that how I am going to counsel the patients in the clinic, and for the benefit of the patient, one acronym by the name of PADHAI. So PADHAI for me stands for, P stands for prevention of complications, A stands for adherence to treatment, very important aspect of management. D again is your knowledge about the dietary aspects of the disease, what diet you should take, what should you avoid. Hygiene, H is for hygiene, very important because a lot of times the patients have lots of erosions. A is again for activity and exercise. Despite you having a severe disease, you have to motivate yourself to be very active and you keep on exercising as much as possible to prevent any long-term adverse side effects of the medicines. And finally, I is for knowledge about the ill effects of the treatment and how to stop it. The subsequent videos will keep on expanding these aspects of the management of the patient. Thank you. Thanks a lot.
Now let's talk about the various problems that you can face in this group of diseases. So in this group of diseases, blisters will form, and that will ultimately rupture, and they will lead to erosions. Now there can be increased pain, bleeding in these erosions, and these erosions can also stick to your clothes, and that will become very uncomfortable. Now because your skin is raw, and because you are also on various treatments that will weaken your immune system, so bacteria can enter this raw skin, and that will lead to superimposed bacterial infections. So if you notice that you have developed fever, or there is sudden increase in pain, or any redness or swelling around the lesions or in any other body part, then you must contact your doctor immediately. Apart from the skin, these erosions can also form in your oral cavity as well, and this will lead to increased pain and increased salivation, difficulty in eating and swallowing, bleeding from the mucosal surfaces and the gums, as well as bad odor. Because your immunity is weakened and because you have erosions, there may be fungal infection also in your oral cavity. This will appear as white curdy patches, and that may also lead to some discomfort. Now, apart from these diseases, there will also be mucous membrane pemphigoid. So mucous membrane pemphigoid causes involvement of the eyes, and that will result in increased pain from the eyes, or increased discharge, decrease in or increase in tear secretion, foreign body sensation, irritation, and inward bending of the eyelashes. If you develop any of these symptoms, then you should contact your eye specialist immediately. Some of these conditions may also be very itchy, and the examples of this are bullous pemphigoid and dermatitis herpetiformis, but this itching usually responds very well and rapidly to medications. Now let's talk about the treatment options for these diseases. So the medicines that will be prescribed to you may take some time to act, and that is why they have to be taken for a long period of time. Now these medicines must always be taken under the doctor's supervision. You should not self-medicate under any circumstances, as it will only lead to adverse effects and inadequate control of the disease. And you should not stop the medications on your own as well, because it might lead to a severe flare of the disease. Now even after the medications have been stopped and you become disease free for a while, the disease may come back after a few months or a few years, and at that point of time you have to visit your doctor again, and further treatment options will then be discussed with you. We understand that sometimes it's difficult for you to come to the hospital at the appointed time because of various personal reasons. So in such a situation, you can continue the medication at the last prescribed dose and for 1 or 2 weeks, and after that you have to visit the hospital at the nearest convenience. Now the various medicines that are used for these diseases may suppress the immune system of your body, because the immunosuppressants will suppress the antibody production that are acting against the skin proteins, and hence the blisters will start healing. The most common medicine that is used for this are oral steroids, and prednisolone is the most common drug. Other steroids may also be used if necessary. The other medicines are azathioprine, cyclophosphamide, mycophenolate mofetil, injectables like rituximab and omalizumab, and some antibiotics like doxycycline and dapsone. Now these medicines may have some side effects. However, we will monitor you regularly for these side effects, and if required, if you encounter any of these side effects, then we will stop the drug at the earliest, or we will modify the dose accordingly. Hence, at most visits, you will be asked to get some tests done, and you will be asked to get the reports of these tests at the next visits. Now, these monitoring tests will help us to detect these adverse effects at the earliest, so that we can keep you safe from these adverse effects and manage your disease properly.
So let's talk about diet now. There is a lot of misconception that diseases like pemphigus and pemphigoid are caused by a certain type of a diet, and you should be avoiding these. But actually, there is not much evidence which suggests the same. So we will not recommend you to stop any particular food item assuming that it is increasing your disease. However, if you do feel that your disease is getting worsened by a particular food item, you should discuss it with your doctor. If you have been advised any dietary restrictions because of your diagnosis of hypertension or diabetes, you have to follow that. Coming to prednisolone, when you will be put on prednisolone, you will have an increase in your weight as well as appetite. This will increase your chances of having high blood sugars, high cholesterol, as well as high blood pressure. So, you have to avoid junk food. You must avoid alcohol and smoking. You must not increase the quantity of food that you are having with every meal. If you do feel hungry even after having a meal, you can consume plenty of fresh fruits and vegetables. If you have oral erosions as a part of your disease, eating hard and solid food items may cause a damage to your mucosal lining and aggravate your erosions. So, eating sugar canes, apples, pears, dry chapati, toast, etc. may cause problems. It is better to have food which is mashed, like vegetables or fruits, and you are preferably supposed to have dalia, khichdi, dal, etc., which will be easy for you to consume. You should avoid very spicy or hot or cold beverages. You are supposed to avoid citrus fruits as well because they will irritate your oral lining. You are supposed to have diet which is rich in proteins. So if you're a vegetarian, you can have dal, chana, rajma, tofu, etc. And if you're non-vegetarian, you can have chicken or egg. The proteins will help the oral cavity to regenerate and reepithelize better. If you have been diagnosed with a condition called dermatitis herpetiformis, you will be put on a strict gluten-free diet. So this will help to have your disease in control, and if done properly, you may not require many of the medications. Gluten is present in wheat, rye, barley, as well as items which are prepared from them, which include flour, bread, pasta, chapati, semolina, beer, etc. Many of the restaurant items and the packaging items also contain gluten. So you can substitute these grains with options like rice, millet, corn, quinoa, etc. So you can have your flour which has been freshly prepared in a chakki or an atta, but ensure that the grinder has been properly cleaned just before your atta is made so that there is no cross contamination with the normal flour. You should always check for the option of gluten free before buying any products, packaged items or restaurant items.
So you must take bath daily with soap or body wash and water. Alternatively, you can also use potassium permanganate to take a bath. Mix 1 to 2 crystals of potassium permanganate in a bucket of lukewarm water until the color of the water becomes very light pink, that is similar to the color of the normal human nail. Once done, pour this water gently onto your skin and rub gently over the erosions to remove any dirt or crust over it. Do not rub very vigorously as it can result in peeling off of the skin. Once done, pat dry with the help of a dry cotton towel. Again, do not rub vigorously while drying as it can result in peeling off of the skin. Appropriate dressings would be prescribed by your dermatologist. Avoid any injury to your skin. So do not apply any adhesive tapes during dressings, as while removal it can result in peeling off of the skin. Do not apply any desi preparations, vegetable matter or any unknown substances onto your erosions, as it can make it worse. Clothes should be washed daily or more frequently if they become soiled with blood or discharge. Preferably wear loose cotton clothes and do not wear tight undergarments, as again it can result in peeling off of the skin. Houseflies get attracted to your eroded skin and can act as a source of infection. So try and keep your environment clean and nurse inside a mosquito net if required. Anybody taking care of you should wash their hands with soap and water before touching the patient. Use chlorhexidine mouthwash in order to keep the mouth clean. Add 8 to 10 drops of mouthwash to half a cup of water and wash your mouth after every meal. Use a soft bristled toothbrush in order to clean your teeth. Use a paste which does not contain any flavoring agents like neem or menthol in order to brush your teeth. Make sure that you keep the brushing limited only to the tooth area and not to the skin around the gums, as it can result in bleeding from the gums and development of erosions.
Now let's talk about exercise. So if you have skin lesions all over your body and it is limiting your physical activity, you should at least try to get up from the bed, move around your house as much as possible. If you are confined to bed, move your hands at wrists and feet at your ankles. Avoid lying down in the bed for long duration. Try to change your position as frequently as possible. If you have skin lesions on your back, try to lie down on your side. So once the lesions have started healing or have healed, try to be as physically active as possible. Once the skin lesions have completely healed, you must do brisk walking exercise at least for 30 minutes in a day, yoga, stretching exercise climbing up the stairs, etc. So that will increase the physical fitness as well as strengthen your muscles and bone. Let's talk about bone health. You may develop osteoporosis or weak bones due to your disease or disease-related physical inactivity or due to medications. In such case, you may be prescribed oral calcium and vitamin D supplements which you have to take regularly every day. You may also be advised DEXA scan, which is used to assess the strength of the bones. If you are found osteoporotic by the scan, then you will be referred to the appropriate doctor for further treatment. You should also avoid falls. If you have to check blood pressure, get your blood pressure and blood sugar levels checked regularly. If you are found to have high blood pressure or blood sugar levels, you will be started on medications which you have to take regularly. You may also develop gastritis or indigestion due to various medications. In such case, you should take the food regularly at regular time, and you should also avoid spicy food, and if required, antacids will be prescribed which you have to take before breakfast every day.
Let's talk about the adverse effects of treatment now. Side effects of medicines are of great concern among patients, especially in case of chronic diseases. All the medicines that are prescribed to you may potentially cause some side effects occasionally. While a majority of these side effects are minor and disappear with an appropriate treatment or stopping the medication, some of them can be severe. You must report to your treating doctor immediately if you are not feeling well and you think this failing is due to one or the other medication. Prednisolone, one of the most commonly prescribed drugs, can cause gastritis, vomiting, acne, increased chances of infection, diabetes, hypertension, cataract, increased pressure in your eyes, or deranged liver function test. As azathioprine can cause significant side effects rarely, it is usually started at a lower dose and the dose is increased gradually later on. Azathioprine can cause diarrhea, vomiting, fever, sudden loss of hair, decreased appetite, high colored urine, etc. If you develop any of these symptoms or you don't feel generally well, stop the medicine and consult us immediately. This can also cause a fall in hemoglobin and other blood cells and can also affect your liver. The later ones can be detected in the routine blood test that you will be prescribed. Mycophenolate mofetil can cause diarrhea, vomiting, fall in hemoglobin or other blood cells and it can affect your liver. Here also we start at a lower dose and gradually we increase the dose to the desired level. Dapsone can cause a fall in hemoglobin, deranged liver function, fever, rash, oral erosions, high colored urine, hypersensitivity, and so on.
Now let us talk regarding vaccination. You may occasionally have queries on vaccination. Do discuss such queries with us. There are two types of vaccines. There is one called live attenuated, so it is actually a live virus, but it is a small dose only. The other one is a killed microorganism or a subunit of it. When you are getting immunosuppressive treatment or about to get it within few hours or days, both of the vaccines are not advisable. Immunosuppressive treatment may also have concerns regarding vaccine efficacy and also on the safety. Since you will be immunosuppressed, some vaccines may be advisable at certain point of time. Do discuss with us which vaccines to be taken and when. Do not hesitate to talk to us in Autoimmune Bullous Disease Clinic if you have any questions.